Paediatric practice is essentially 0 to 18. And within that span of ages, there are certain groups have certain problems really in ENT. So for example, 0 to 3-year-olds, the ones I see often have breathing problems at night, which will result in their not gaining weight as much as we'd like to. So we have a full service for dealing with obstructive sleep apnea, which is breath holding during sleep in 0 to 3s. It does occur in older children, but it becomes less common once you get past about 3 or 4 years of age. Also in that group, 0 to 3, we have recurrent ear infections, often related to teething. So GPs send those children to me so see if we can break the cycle of recurrent ear infections. From 3 to about 7, the focus firmly settles on hearing. So deafness, particularly caused by fluid behind the drums called glue ear, is very, very common. In fact, it's almost normal. And in the majority of children it gets better, but I only see those ones where the fluid persists and they have hearing loss, which impacts on their speech, language and number skill progression and their educational progress generally. From about 7 onwards, then I start seeing tonsillitis, which is inflammation of the tonsils, severe enough to lead to absenteeism. And it's usually the non-attendance at school prompts parents to seek advice from their GP, and those GPs then send the patients to me for assessment. The other service we have, which allays a lot of anxiety, is persistent lumps in the neck, lymph nodes. They cause a lot of anxiety. They can be quite huge, particularly quite big, particularly in younger children. And we have a service here of ENT and working in conjunction with radiology using ultrasound to look at the internal structure of these lymph nodes. And it's very rare for me to actually excise a node to get a diagnosis because the ultrasonography here is so good.